One of the questions I frequently receive from my patients, and perhaps many of you here have also heard it, is, Doctor, is it true that eating bananas at night can cause a stroke? Should I avoid certain fruits to protect my health? This is a very real concern, stemming from the desire to protect oneself and one's family. And today, with deep professional consultation from the neurologist on our team, we will clarify this question once and for all. The answer may surprise you. The potential stroke risk does not lie in any specific type of fruit. I repeat, there is no bad fruit that can, by itself, cause a stroke overnight. The real danger, my friends, is how do we eat fruit? Therefore, in this video, we will not waste time listing which fruits to boycott. Instead, we will do something much more useful. I will outline the 3 most common mistakes when eating fruit that can truly affect your vascular health. And more importantly, after understanding those mistakes, I will provide you with a system of 3 incredibly simple golden rules so you can enjoy fruit, that wonderful gift of nature, in a completely safe and nutritious way. Before we dive into the first mistake, I would love to know, have you ever heard similar rumors about food? Perhaps about bananas, a certain vegetable, or any other food? Please share what you've heard in the comments below. Our discussion will help many others learn as well. And if this is your first time here at Healthy Steps Seniors, please hit the subscribe button to join us in discovering useful medical knowledge like this in our future videos. Now, let's examine the first mistake together.
Mistake number 1. Eating fruit alone and in large quantities. The first, and perhaps most common mistake, comes from a very normal habit: eating fruit by itself, as a standalone snack, and often in large amounts. Many of us think a large plate of fruit in the afternoon is a healthy choice to combat hunger. But biologically, this action can create an unfavorable environment for our blood vessels. When you eat fruit with nothing accompanying it, especially sweet fruits, the natural fructose within is absorbed into the bloodstream at a very rapid rate. Imagine your body has no brake to slow down this flow. To cope with the sudden rise in blood sugar, your pancreas is forced to respond by releasing a powerful wave of insulin. The purpose of insulin is to quickly move sugar out of the blood and into the cells for energy. However, this strong reaction often leads to an unintended consequence. It can drop your blood sugar to a level even lower than where it started, causing feelings of fatigue, sluggishness, and brain fog about an hour or 2 after eating. This is the sugar crash phenomenon that many people experience. But that's just the immediate feeling. The real danger lies in the long-term effects. Each time your blood sugar spikes and then plummets like this, it creates a state of low-grade, simmering inflammation inside your blood vessels. Imagine your blood vessels are like highways. Each blood sugar spike is like a fleet of heavy trucks suddenly rushing through at high speed, causing wear and tear and microscopic cracks on the road's surface over time. It is these cracks from inflammation where bad cholesterol molecules can begin to attach, initiating the process of plaque formation. So the core issue here isn't that the natural fructose in an apple is bad. The real enemy is the speed and intensity at which that sugar is absorbed into the blood when there's nothing to hold it back.
This leads us to the second mistake, a more subtle one, because it requires an understanding of our own bodies. It is the mistake of applying generic health advice while ignoring personal medical conditions. Mistake number 2. Ignoring personal health conditions. A classic example concerns the mineral potassium. We often hear that potassium-rich foods like bananas, avocados, or sweet potatoes are very good for controlling blood pressure, and that is absolutely true for the majority of the healthy population. Potassium helps balance sodium levels in the body and relaxes blood vessel walls. However, this advice can become dangerous if you have chronic kidney disease, even in its early stages. When kidney function is impaired, the ability to excrete excess potassium from the body is also diminished. Similarly, some medications for heart disease and high blood pressure, such as ACE inhibitors or
Angiotensin receptor blockers, or ARBs, have the side effect of retaining potassium in the body. In these cases, if you heedlessly eat a lot of potassium-rich foods, the potassium level in your blood can rise to a dangerous level, a condition called hyperkalemia. This condition can cause symptoms ranging from muscle weakness and fatigue to serious heart rhythm disturbances that can be life-threatening. Once again, the problem is not the nutritious banana. The problem is the lack of awareness of the interaction between a healthy food and a health condition or a medication you are taking. Mistake number 3. Forgetting that food can interact with medication. And the final mistake, perhaps the most dangerous because it is entirely preventable, yet the least warned about, it is the failure to realize that food can interact with drugs just as drugs interact with each other. The most classic and well-researched case is the grapefruit, including both the whole fruit and its juice. Grapefruit contains a group of natural compounds called furanocoumarins. These compounds have a unique ability. They inhibit, or in other words, disable, a very important enzyme in our intestines called CYP3A4. Why is this enzyme so important? Because it is responsible for breaking down and metabolizing a long list of medications we use daily, including some of the most common cholesterol-lowering drugs, statins like Lipitor or Zocor, some blood pressure medications, anti-anxiety drugs, and many others. When the CYP3A4 enzyme is disabled by the compounds in grapefruit, the metabolism of the drug is significantly slowed down. As a result, a much larger amount of the drug than normal is absorbed into the blood. Think about this. You are still taking the pill at the exact dosage your doctor prescribed, but just because of a glass of grapefruit juice you had at the same time, the concentration of the drug's active ingredient in your body can spike dramatically, equivalent to taking multiple pills at once. This skyrockets the risk of serious side effects, from muscle pain and liver damage to more severe problems. The enemy here, once again, is not the vitamin C-packed grapefruit. The real enemy is a gap in medical communication and a lack of awareness about these potential interactions. So, we have identified the 3 key mistakes together. It's not about banning any particular fruit, but about how we eat, understanding our bodies, and communicating with our healthcare team. In the next section, we will turn this knowledge into concrete action with 3 incredibly simple golden rules.
The 3 golden rules system for smart fruit eating. In this section, we will turn that knowledge into concrete action. These are not complex or difficult rules. These are 3 incredibly simple golden rules designed to help you enjoy nature's wonderful gift with safety and confidence. The first golden rule, and perhaps the most important one, that can change the way you eat fruit forever is this: never let fruit go alone. This is the direct solution to mistake number 1 that we analyzed, the blood sugar spike. When you eat fruit by itself, especially on an empty stomach, its natural sugar is absorbed into the blood almost instantly. To prevent this, we need a biological break, and that break is protein and healthy fat. When you pair fruit with a protein or fat-rich food source, you slow down the entire digestive process. Protein and fat require more time to be broken down in the stomach. This means the sugar from the fruit is held in the stomach longer and is released into the bloodstream slowly and steadily, like a gentle stream instead of a sudden flood. Applying this rule in practice is very simple. Instead of just eating an apple, slice it up and dip it in a spoonful of natural unsweetened peanut butter. Instead of a bowl of strawberries, mix it into a cup of plain Greek yogurt. A small handful of nuts like almonds, walnuts, or pecans is the perfect companion for any fruit. This simple act not only prevents the blood sugar spike and its accompanying inflammatory response, but it also helps you feel full longer,
provides more stable energy, and avoids the post-meal fatigue or brain fog. It turns a simple snack into a balanced and nutritious meal.
After knowing how to combine foods intelligently, the second golden rule will help us choose which fruits should appear most often on our menu. That rule is, prioritize the champions of fiber and antioxidants. Not all fruits are created equal in terms of their impact on the body. Some contain more sugar and less fiber, while others are true nutritional powerhouses. Our choice should lean towards the second group. The top champions on this list are the berries. Blueberries, strawberries, raspberries, blackberries, they are nature's precious gems. They're relatively low in sugar, but extremely rich in fiber and a powerful group of antioxidants called anthocyanins. These are the compounds that create their deep blue, red, and purple colors, and they have been scientifically shown to protect the delicate lining of our blood vessel walls, reduce inflammation, and improve brain function. Next are familiar friends like apples and pears, but with one important condition: eat the skin. The skin is where most of the soluble fiber pectin, which helps slow sugar absorption, and anti-inflammatory compounds like quercetin are stored. When you peel them, you inadvertently remove a part of their health protective value. And of course, we cannot forget the avocado. This is a special fruit because it contains very little sugar, but is rich in heart-healthy monounsaturated fats, fiber, and especially potassium. This combination makes the avocado an excellent choice for supporting cardiovascular health and maintaining stable sugar blood. This doesn't mean you have to completely avoid other sweet fruits like watermelon, pineapple, or mango. Simply view them as a dessert, enjoy them in smaller portions, and always remember to apply rule number 1: pair them with protein or fat.
And this leads us to the third golden rule, a principle that isn't about the type of fruit or how to combine it, but about your own wisdom and safety. This is the rule that encompasses all others. It is, communication is the best prevention. This principle is the direct solution to mistakes number 2 and 3 that we analyzed: ignoring personal health conditions and the risk of drug interactions. Your doctor and pharmacist are not just prescribers, they are members of your healthcare team, treasure troves of knowledge that you have every right to tap into. Your safety should not be based on guesswork or information found on the internet. It must be based on clear and open communication. The next time you have a follow-up appointment or receive a new prescription, do not hesitate. Proactively ask your pharmacist or doctor these 2 simple questions. You can even write them down. The first question: Doctor, pharmacist, with my kidney or heart condition, do I need to be mindful of or limit any potassium-rich foods? And the second question: do the medications I'm taking have any interactions with food, especially grapefruit? A 5-minute conversation can give you peace of mind for years to come. It can be the difference between eating with anxiety and enjoying food with confidence and safety. Never underestimate the power of asking questions. Those are our 3 golden rules. Very simple, yet incredibly effective. I would love to know, of these 3 rules, which one do you find most useful and easiest to apply for yourself? And do you have any smart fruit pairings that you love? For example, apples with cheese or avocado with eggs. Please share your recipes and experiences in the comments below so we can build a more well-informed eating community together.
At our age, the body no longer remains silent as it used to. It constantly sends us signals: a slight ache in a joint, a feeling of bloating after a meal, or a sleepless night. The wisdom of age lies not in ignoring these signals, but in learning to listen to and decode them. The feeling of fatigue and sluggishness after eating a large bowl of grapes is not a punishment. It is a message. The body is telling you in its own language, this amount of sugar at this time is perhaps a bit too much for me to handle. To illustrate this most clearly, allow me to tell you the story of Mr. Arthur, a wonderful patient of mine. Mr. Arthur had pre-diabetes and was on medication to manage his cholesterol. He had a habit he believed was very healthy, eating a large bowl of grapes every afternoon. But he noticed that afterward he often felt very tired and somewhat foggy in the head. After talking with us, he did not give up the grapes he loved. He simply listened to the message his body was sending. Now, instead of a large bowl, he eats a smaller handful of grapes, and importantly, he eats them with a few almonds. With just that small change, based on applying our first rule, his afternoon fatigue completely disappeared. Mr. Arthur's story is the perfect testament to our philosophy here at Healthy Steps Seniors. It's not about avoiding a fruit, but about listening and eating intelligently. So let's summarize the 3 golden rules we learned today. First, always pair fruit with protein or healthy fat. Second, prioritize fruits rich in fiber and antioxidants. And third, always communicate openly with your doctor and pharmacist. Now it's your turn. What is your first step after this video? It doesn't have to be anything big. Maybe tomorrow, when you eat your apple, you'll try it with a spoonful of unsweetened peanut butter. Turn knowledge into action, no matter how small, and share that commitment with us in the comments. And if you found this knowledge helpful in protecting your health and that of your loved ones, please take a second to hit the like button, share this video, and especially hit the subscribe button for the Healthy Steps Seniors channel so we can continue to walk together on this health journey. Remember, food is not the enemy. A lack of understanding and a lack of listening are the risks. By arming yourself with knowledge and learning to have a dialogue with your body, you are turning every meal, every small choice, into an act of nurturing and protecting your own precious health. Thank you for your time. Be well.